Now, in trying to treat asthma, the drugs of choice are basically drugs that when you take, they go into the respiratory system, right? Not the ones that they go to the respiratory system directly. So you have fewer systemic involvement. Not the ones that where you take, they have to go through the whole body. I don't know if you understand me. But sometimes there are some drugs that go through the whole body that also help in treatment of asthma. Those are the oral formulation. So you give them orally. So oral formulation, they are less commonly used, okay, because you prefer drugs that when you inhale, they go directly to the respiratory system, right? But let's look at the examples of the oral formulations. So we have the oral corticosteroids, drugs like prednisone, prednisolone, methylprednisolone, okay? So they are used for acute severe asthma, and all of that. They have some one or two side effects like weight gain, osteoporosis, hypertension, Then leukotriene receptor antagonists. These are drugs like what? The Montelukast and the Zafirlukast. Okay, they are used mainly for patients that have allergic asthma. You have asthma because you have been reacting to something. Your immune system is reacting adversely to something. Then we have the Theophylline and the Methylxanthines. They're usually add-on therapies for moderate to severe asthma. That's when inhaled options are insufficient, right? So most of them, you only use them if the inhalational drugs have not given you the result you want, or if they are not available. Then oral albuterols like salbutamol, okay, terbutaline, okay. So that's just it, So these ones, you should know that they still have the inhaled forms. So if the inhaled forms are there, why not go for the inhaled forms than the oral forms?